When there was COVID outbreak in China, it started as a joke, but when it went to Europe and America, first world countries started producing and also importing more ventilators. Now, developing countries may not have the opportunity and the capacity to produce more and also import more, as ventilators are very expensive. Now, our own scientists at Makerere University innovated a ventilator that can be actually useful to manage our COVID-19 patients. Urban Magazine reports more.
Coronavirus COVID-19 cases are more than 7 million. The pandemic has so far claimed more than 420,000 people throughout the world. While 80% of the patients may experience mild symptoms, more than 20% will have severe and fatal symptoms, which create a need for management of their condition on life support, and without medical ventilators, their lives are in dire danger or may not be saved. However, the cost of a ventilator in third world countries is too high for healthcare systems. An average ventilator costs 25,000 shillings, about 90 million. Uganda has close to 100 ventilators in 12 functional high dependency care units, equipped with a total of 55 functional beds in 14 regional referral hospitals. With nearly 700 patients Uganda has registered, if 20% were to go to ICU, it would need about 200 ventilators, or shillings 1.8 billion. Therefore, a cheap and locally made ventilator is a godsend. On Thursday, the Ministry of Science, Technology and Innovation, through Kiira Motors Corporation in conjunction with Makerere University School of Public Health, unveiled a low-cost medical ventilator. According to the Makerere University Deputy Vice Chancellor in charge of Finance and Administration, Professor William Bazeo, the ventilator named Bulamu, which means life in the local dialect, is supposed to breathe life into ailing patients. It was manufactured using pipes, plumbing equipment, metals, which were locally sourced and developed by researchers at Makerere University.
And then we said, yes, the engineers in Uganda, if they can make a car, they can make these other things. Why not this ventilator? So we came together and said we needed some of the materials to use. Fortunately, Honorable Minister, these materials were in Uganda. They were here being sold and used by other institutions doing other things, people in TVs and so on. But our engineers were able to turn them around and say, we can make our own ventilator, perform the same work, do it very well, and at a low cost. We realized that the ventilator is close to $25,000. If we needed 100 or even 10, 250,000. If you put it in local money, you are in billions.
The production started in April and concluded in May. A medical ventilator is a machine that provides mechanical ventilation by moving breathable air into and out of the lungs to deliver oxygen to a patient who is physically unable to breathe or breathing insufficiently. This ventilator costs slightly lower than $4,000, which is more than 6 times less than the cost of a ventilator at the international market. It will support the management of acute respiratory distress syndrome caused by the coronavirus. The initiative to manufacture a ventilator came from Vincent A. Sembatia, the Director for Quality Assurance at Makerere University.
Okay, at the time when the COVID pandemic was declared as a pandemic, everyone dashed home. We started hiding. So scientists normally, when they hide, they think of how best to leave that hiding place. So a lot of us started thinking hard what would happen, and we are looking at things that were going around. We are looking at the situations, especially medical equipment. So we had this discussion before, like how best, and we had been warned by people like Bill Gates that these countries in Africa are going to be most hard hit because of poor facilities in the health care system. So we said, no, this cannot stay the same. So as we started discussing with our collaborators, they told us that it's not any different in their countries. It's a different magnitude though, but they had come up with a way to make a ventilator using the local equipment. Making a ventilator is not the novel thing because it has been made before, but making it from materials that you get from hardware stores, pipes, valves, plumbing equipment. So I said, now they challenged us to look around and see how best we can manipulate, modify equipment, and come up with this simple. For them, they had done it, but their environment is different from ours. So we couldn't say we can utilize the same methods, because for them, you can walk in the store, buy all gauges, buy all controllers. Here, it's not the case. So it became a challenge for us, and we decided that we take it on. So that's from the time of around 1st April to this. We gave ourselves a challenge. We thought we could do it early. We can pull it off earlier, but of course we faced all forms of other challenges, especially in the lockdown. You can't do a lot of movement. When we started, it was almost complete lockdown. It was even difficult to get people from around. They had to stay here overnight and all that. So, but that's where it came from. Like, the challenge was global, and ours was like, we can prove that it can be resolved using African means, African people, and the real traditional knowledge that we have.
Even with a global lockdown, the engineers looked at this as an opportunity to embrace the double challenge, not forgetting Uganda had never made a ventilator before to make the unimaginable come to light. The funding was provided by a Resilient Africa Network, a project at the School of Public Health, Makerere University.
Our goal is ultimately to see that the supply chain is localized. So as we are working, we are ensuring that a lot of the work is actually being done here. In this ventilator, we have made the printed circuit board. That's like the motherboard of the ventilator here, where we have the brain of the ventilator and a few other electronics. We have made the casing here. We got a platform software, but it could not do even half of what we needed to do from the open source society. And our engineers have been able to build a number of use cases to make this possible. Our hope and prayer is that as we walk along, we will work with your office in the immediate to explore what we call emergency use approval. So that in case there is need immediately, we have emergency use approval, and then we continue leveraging your good office to see that we can have the entire protocol for certification and approval being done in the shortest time possible.
The chief engineer of the Bulamu ventilator project, who doubles as director product development at KMC, states the process that led to what Uganda can proudly call their own ventilator.
So this ventilator has different subsystems. One is the box and the stand, and that one we are using really local materials, stainless, some stainless steel and then mild steel. We worked with the Victoria Engineering and Pumps to do that. Then we have also electronics, that is a printed circuit board, which was also made here by a local company, BD Applied ICT Center. Then we have the plumbing and the pneumatics. The plumbing is really the pipes taking the air. Those are also sourced from the local market.
Wadada breaks down how much the team used to manufacture the ventilator.
The first ventilator, we gave it an allocation of $300, the cost of the ventilator. But eventually we, of course, spent around $1,000. Now, that was the total expenditure on materials and requirements. That doesn't translate into the cost of the ventilator.
During the launch, the Health Minister, Dr. Ruth Cheng, said the production of the ventilator is timely since Uganda is hosting patients at Nambole Stadium as the COVID-19 cases figures keep rising. She clarified why Nambole was chosen to accommodate patients.
Prepositioning Nambole to receive patients and accommodate patients is not making Nambole a hospital. If many of you have been following closely what is happening in other countries, you see that not all patients are managed in a hospital setting.
She's hopeful the ventilators will reach their final destination, that is the hospitals.
I'm looking forward to the day when I will have the ventilator where it is supposed to be, in the facilities, doing the work that it is supposed to be. Not only for COVID patients, because there are other patients who need ventilators, and they're out there every day.
Freddie Emmanuel Mugunga, the Undersecretary who doubles as spokesman Ministry of Science, Technology and Innovation, was recently quoted saying that upon final approvals of the ventilator, it will be available to support life in ICUs even beyond the COVID-19 pandemic. Before the ventilators are distributed to hospitals, the team will test them on animals. The testing will be led by a team from the College of Veterinary Medicine, Animal Resources and Biosecurity and Makerere University to assess the level of tissue perfusion with oxygen. Thereafter, clinical trials on human beings led by anesthesiologists and epidemiologists from the College of Health Sciences, Makerere, will be done before the ventilators are finally used by patients. One would wonder how long this process will take.
So the next steps would be now testing and validation and approvals. The first test will be what we call the bench test, done with the doctors using some test equipment called test lungs, where they verify and calibrate some of the parameters of the ventilator. They confirm that the ventilator is doing what it's supposed to do. Then from there we go to the animal testing. Animal testing is a sort of a standard procedure for equipment in the medical field. Here we are going to work with a team of veterinary doctors to do the animal tests. And then from there we do our clinical trials with patients. They may not be patients, ordinary, Ugandans, volunteers, yes.
We believe Uganda's locally made ventilators will not only save life in Uganda, but also on the continent and world over, as soon as they are approved.
Supply system for our ventilator. It comes into the ventilator behind there. We have the power supply system, which we hook up at the back, and then we switch on the ventilator. And once we turn it on, we can see all the collaborating institutions. We can set the parameters for the ventilation depending on the patient you have. As we've been told, COVID-19 patients require, for example, a respiratory rate, an IE ratio of 1 to 3. So the settings will vary depending on the different patients that you have. And then we can start the ventilation. So the system is capable of informing you if there are any alarms, if anything has gone wrong, and it will do continuous monitoring of the pressure being delivered to the patient, the tidal volume that has been delivered, and the flow rate at which it's delivered. We can also see the respiratory rate, that's the breaths per minute. Yes, that's about it.
Report compiled by Ruth Naseje.
With all the innovations and government interventions, this has not managed to defeat COVID-19, which is still putting countries and cities on the lockdown. COVID-19 has brought stress in families, increasing domestic violence cases and making so many people distressed.